At a camp for those who fled violence in Eastern Democratic Republic of Congo, Justine Mungwiko is soothing her crying baby. She's a woman who needs answers around Mpox.
This skin lesion disease comes from I don't know where. I can't even remember the name of the disease. We were told that it comes after eating game, but neither I nor my child have eaten game. These symptoms just appeared.
Mungwiko's experience highlights one of the challenges as the international community looks to tackle the Mpox outbreak: getting the knowledge they need to protect themselves to those who need it most. Her son is one of approximately 27,000 cases of Mpox in Congo's current outbreak, which began in January 2023, causing an estimated 1,100 deaths, mainly among children. Last week, the World Health Organization declared Mpox a global public health emergency after the disease spread to neighboring countries and outside the continent. But it's communities like Mungwiko's that are most exposed and in need of support. The right information has to get to those immediately at risk, says Associate Fellow at Chatham House's Global Health Programme, Dr. Ebere Okereke.
Communicating with people about what they should do, what they should report and how they should report so we can understand what's going on quicker and contain it better is critical.
But it's not only those at the Kanyaruchinya camp near Goma suffering from a lack of knowledge. Helen Rees, co-chair of South Africa's Mpox Incident Management Team, says that over the past 50 years there has been a shameful lack of investment to help African researchers understand Mpox better.
We still globally do not have a good understanding of Mpox, on the outbreaks, how it spreads, how many asymptomatic cases do we have for every case that we find with symptoms. We do not have a good understanding.
Back at the camp, there are some efforts underway to inform. On Monday, residents gathered to hear a health worker from aid organisation MEDAIR explain how to avoid infection. "We thought there was no medicine," said one attendee, clutching a leaflet. "I'm glad to hear it's curable."
Bonjour tout le monde, asseyez-vous. C'est vraiment toute une chaîne logistique qui va de notre acceptation d'abord et ensuite de quelques procédures administratives avant l'expédition. Mais notre plan stratégique de réponse de vaccination, lui, il est déjà prêt. Nous attendons juste que le vaccin arrive.
It's all about money and profit, and there's no money or profit in the developing world, and particularly in Africa, which is why you need a system, which is what the World Health Organization has called for, where vaccine technology is shared all over the world, where we invest in factories all over the global south. And there's plenty of scope to make profit in such a system, but you would have the ability of poor countries in the face of a crisis like this to make their own vaccines and make their own medicines fast. They didn't want to share technology. They didn't want to open up their patents. They didn't want to threaten the profits of their pharmaceutical corporations. So we have the same broken system walking into another pandemic just a few years later is the definition of stupidity. And I think the European leadership played a huge part in being the problem there, just as they did in COVID-19.
Bueno, voy a grabar esto.
No vayan a ver las cosas lo que se ahogó, después van, no lo...
Bueno, voy a grabar esto.